tell you that if you're expecting to come on here and just listen and not do anything, you might be a little surprised. I'm going to actually ask you to talk to each other. I know it sounds like already this group, you don't like each other and you don't like talking very much. I'm kidding. So we're gonna have an opportunity after a bit. We're gonna put you in groups, let you talk to each other about some of this, because as I was talking with Jill earlier, this can be kind of an emotionally charged subject. We're going to be talking about depression and anxiety and suicidal ideation and substance use and all those things that can be pretty serious. And so I just want to do just a real short disclaimer. As I talk about these things, we are going to be, I'm going to show a short film. We're going to have some discussion. We're going to talk about some of the things that are affecting Kansas specifically. But one of the things I always like to tell groups as we talk about this, that if any of this is, kind of more sensitive to you, if it's something that kind of triggers anything for yourself or something your family's dealing with, please reach out. You can always private chat myself or Jill, and we can definitely get some resources headed your way. So I always like to preface it that, because again, as we talk about these things, sometimes it can bring some stuff up for folks. So I do have a PowerPoint. This is not by any means going to be a lecture. I just want to share some information and then again, guide some of the conversation. Because one of the things that when the first conversation I had with Sean, he said, this keeps coming up. We keep talking about how behavioral health or mental health, substance use, those things are affecting our state, for those of us that live in rural areas, that sort of thing. So I just want to, again, give you a little information and then open up really the conversation a little bit more, to talk about it. So I'm going to switch over. I'm sharing my screen here. And if for some reason I can see Susan, I can see you in the thumbnail. If for some reason you can't hear me or clearly, please let me know. I've tried to change some of my settings because I'm out here in Western Kansas. As we all know, sometimes broadband's not amazing. And so if I'm losing you, please let me know. So one of the things that we're going to talk about tonight is that the importance of starting these conversations. I think for a lot of years, I grew up in rural Kansas, and I live out near Dodge City now. We were just talking about some things out here in Dodge City, but I think it's important to recognize some of the barriers that we're facing when it comes to mental health, substance use, disorder treatment, what's preventing people from getting the help they need. And then I want to hear from you guys what you think might be some options or some things available to us. So just real quick, my information is there. If there's anything you have questions about, want more information after we get done, please reach out. This is an area I'm especially passionate about. Rural equity, when we talk about health services, behavioral health, all of that. Love sharing information. So there's my phone number and my email there. I am with the KU School Social Welfare. I'm the coordinator for strategic initiatives. I've worked for the university for about 5 years. But I wanted to just quickly, just as something Jill and I talked about, I thought it might be important to just share why this is so important to me personally. So I just wanted to share just quickly a little bit about myself and why this has become so important to me. I grew up in Hayes, America. So some of you might know where that is, I'm guessing, and went to school, grew up. My dad ran a few cattle, not a lot, but we always rodeoed and participated in 4-H and those kinds of things. So grew up and out there in that area. I went to K-State, yay, right? Wildcats. I saw some K-State stuff out there. I want to mention that because I don't want the KU stuff to fool you. Truly a Wildcat at heart. I did go on to graduate school at a place down the road, but got my degree, a clinical social worker, as well as a clinical addictions counselor. Started working in community mental health center a lot of years ago. It changes every year. I always have to think about that. It gets, I have to add one every year, but it's been a few years now. I spent some time in Colorado, also working in a very rural area. Ended up moving back to Kansas. I met a boy. Isn't he attractive? He's going to hate that I showed this picture, but moved back. And interestingly enough, I moved back to Jetmore, Kansas, which is kind of interesting because my dad grew up in Jetmore. My grandpa, he had harvest cutting crews. They did custom cutting for years. And so I'm always meeting people that like knew my dad, which is kind of cool. But have always been around farming, ranching. That's kind of always been part of the environment I grew up in. And so when I moved back to Jetmore, I was working in a community mental health center. And one night I met with a gentleman, and we were talking about some of the thoughts he'd had, gotten pretty depressed, had some thoughts of suicide. And we talked. He said, yes, he'd be comfortable coming in and talking to me. And when we looked at getting him in to see me, it was about 6 weeks. And so just to think about that, if you were wanting care, finally open to getting the care you need, and then they said, well, it'll be about 6 weeks before we can get you in. I thought, man, I started getting really frustrated. Like, that's not good enough. Really kind of frustrated with the system, the lack of clinicians, lack of workforce. And so that's why I came on with KU. I became very passionate about bringing resources to our rural area. I continue to live out here. I've worked remotely for KU for about 5 years now. And so when I was approached about this, I thought this is a great audience to start talking about this, because this is something that's affecting, it affects me, it affects my friends, my family, the people I live and share my community with, as well as, I'm guessing, for some of you, the same thing. So I just wanted to share that because I do think it's important to understand where I'm coming from. This is definitely something near and dear to my heart. And I think it's great that KARL is sharing this time to talk about this really important stuff. So this is just a really loose agenda here, but I'm going to talk about just some of the why. I think it's important to know why this is so present in our communities, a little background there, also addressing some of the big barriers, which is stigma, and then resources, which tend to be some of the big two that come up for people. And then I want to leave time for questions and time for us to kind of discuss it. So first off, you've heard from me why this is, kind of a passion of mine. I thought it would be nice. There's a social media campaign that Douglas County put out there, and just to hear from folks in the industry, farmers that have experienced depression, other mental health challenges, and they came together with the K-State Research and Extension and put this out there as a social media campaign. So we're going to watch that. I'm going to stop sharing, and then I'm going to take us back to that. And I have not been able to watch the chat here. So let me know, Susan, Jill, whoever, if there's anything in the chat I need to address as we go along. But let me bring this up here.
Yeah, I think you're good right now with regard to chat questions.
Okay, thank you. All right, I'm going to watch this, and then we'll have an opportunity just to discuss it. I want you to kind of think about, is this shocking to you, the things you're hearing, or is some of this hitting home? Do you know folks that maybe have felt this way, maybe yourself, had it at a period of time where, things get tough, things are rough right now out there. So let's watch this, and then we'll have a chance to discuss it further.
I really love being out in the open and putting a seed in the ground and kind of watching it grow and being able to, enjoy the reward of watching it grow all season long and harvesting it in the fall.
Being able to connect people with the land, to connect people with their food, to help them have that bond. That's really what I love about farming, and that's why I wake up every day and do it.
Most farmers, I think, do it because they feel called to it, and they wouldn't do anything else. But it's it's a hard calling. Gosh, just climbing in and out of the tractor, or walking the fields, or lifting the bales, or lifting the boxes, or just the constant stressors. It takes a toll.
Right now we're facing terrible prices, and that really weighs on our decisions that we have to make every day on the farm, whether we're going to buy this or buy that. Weather has been playing a huge factor this year, and we were late getting everything in, and it's going to be really late getting everything out as far as harvest.
It can be a real burden when every day is another challenge and you can't work your way out of them. And so the loss of revenue, thinking about how do we cover our loans, how do we pay back our debts, How do we fulfill contracts with customers that we've agreed to, where we've lost an entire crop, but we still need to fulfill those contracts so that we can keep that customer going into the following year?
Yeah, it just kind of all piles up on you all at once, it seems like. It's just one of those deals where my father had passed away, and I was kind of mopey, and I just wasn't really feeling like myself. And my wife's like, "Hey, I think it's time to maybe talk to your doctor." And I had a physical scheduled with my primary doctor, and he's like, "It's okay," And I talked to him about it, and he's like, "It's okay. We can just figure something out," and give me a list of people I needed to talk to, and I started calling, and found the right fit for me. I was kind of skeptical because I'm a farmer. We don't do stuff like this, and but it did help. I mean, it really was kind of eye-opening to come at it a different way. And she gave me some tools that I'd never ever thought about using to kind of help combat some of the stress and some of maybe the anger issues I was having in certain situations.
We all got to a pretty low point here when the rivers were rising at the end of May and June, where it was hard to see the light at the end of the tunnel. I didn't personally go see anybody, and I should have. And I think about that quite a bit now.
At times we will all struggle with anxiety, with depression. When it becomes a problem is when we don't address it and we don't take care of ourselves or take care of each other. Then what happens is it becomes worse, and then again we start to isolate. It affects us physically, and it is treatable, and it is very important to get that treatment. And what we need to do is educate ourselves. We do good work as far as knowing the signs of a heart attack or the signs of a stroke. But what happens is we're not very good at identifying signs of someone who's struggling until we look back, and then we can see that those signs were present. So educating ourselves in the signs of what it looks like when someone is struggling and not doing well. And then secondly, intervening, either going to someone and saying, "Hey, I see you're struggling, can I help?" Or "How can we help you walk through this together?"
Here at Headquarters, Inc., we are the largest and most comprehensive suicide prevention organization in the entire state of Kansas. We provide resources and services to all 105 counties. So regardless of where you happen to be living, there are services that are available through our office. There are services that are available through the K-State Extension agents in your local communities. There's resources available through mental health facilities and hospitals right in your own communities.
I'm not sure how many farmers have that comfort level in their conversations that would help cue people that their struggle isn't just their lost crop. Their struggle is dealing with the loss and being able to wake up the next morning and have the same struggle, and the next morning and the next morning. So I think the best gift we can give that special community of farmers who do so much for us, most of the time unrecognized work, is to somehow help bring those conversations out, help be a safe person to really talk about the deeper things that need to be said, and when they're not, they can lead to, ill health, they can lead to the sense of lack of well-being and depression, and sometimes farmers have, sadly, a high suicide rate. And just knowing the national data, knowing the data around Kansas, we have a problem. And part of it is probably related to the fact that we don't like to talk about these things. I mean, the general population doesn't like to talk about mental health or be stigmatized by the topic of, you know, depression or anxiety or thinking about suicide. But we've got to talk about those things. That's how we get better. That's how we can really support each other.
Okay, so I'm going to stop sharing. That link is available. I think they were going to make the whole PowerPoint. There's going to be a lot of resources I'll share later, but just wanted to get some ideas from folks, maybe hear from maybe 2 people. Because of time, I want to be aware of everyone's time tonight. What did you think of the film? Did that sound like something that, you know, when they talked about the reluctance to talk about these things, what did you think about that?
I think it's totally right on.
Yeah. So Jerry, I appreciate that. Do you think, what are the reasons that maybe that's difficult for folks to talk about it?
Farmers are very macho, and I've done a lot of mental health work myself, Christina, and it's not just a barrier that you have to let down, but you have to risk some of that macho attitude about the fact that I'm independent, I can do it on my own, and I don't need any help. And it's very difficult to get past that.
Yeah. And Steve, I really appreciate you offering that view and that, you know, being able to talk about these things is key. You know, it's our first step. And you're right. I think stigma is not anything new to those that live in rural areas or to farmers and ranchers. It's everywhere. Stigma is everywhere around these things. It's not something that's just in this group. As it was mentioned in the film. You know, it is something that I think, you know, as I grew up in this, you know, in an atmosphere where we didn't talk about things outside the house, right? It was family business. You know, you kind of, you pull yourself up from your bootstraps and you go on, right? And so those kinds of messages become pretty ingrained in us, and it gets difficult to get past that. Yeah.
I don't think they really touched on it in that clip you showed, but if your problems happen to be financial rather than weather and low prices, and you've gotten yourself into a financial bind, that's even worse to talk about, because that makes most people feel like it was a failure of my management.
Yeah.
You know, to handle that. And if that's what's driving your depression, that's tough to break.
Yep. Yep. And Steve, that makes perfect sense. I think that's a great point. You know, it could be a myriad of things that people may be facing, different parts of the state, different timing, different outfits, you know, different folks. But it all leads to some pretty common thoughts of, you know, what that means or judgment about ourselves. And then that can lead to some depression, anxiety, and other issues. Yeah, Susan, did you have something?
No, I would,
Okay.
you know, there's a couple of comments that maybe I'll just point out for if you hadn't seen them, Christina.
Okay.
One is by Louise M. Key, and she talks about serving on the Compass Behavioral Health Center board and just the impact that they've been able to have because of what's going on in the communities that they serve. And then another comment that Leslie Schmidt made about encouraging everyone to get mental health first aid certified. And then she posted a website there that has that service, and just, you know, how can you help each other in the communities? We either, you know, Louise serves on her behavioral health board, and then Leslie's mentioned getting certified in some sort of mental health first aid.
Yeah, thank you for pointing that out, Susan. I appreciate it. Yeah, I think, you know, that's one of the things that we'll talk about a little later is how can people get involved? How can we start to move forward? And these are great examples, and I'll have an opportunity for folks to share more as we go along, because I do think, you know, one of the things I was talking to Jill earlier about is I'm probably not going to have the answer to all of this. I wish I did. But the best answers are going to come from folks like you, folks that are in those leadership roles. You're in the community to really kind of take some of this forward and figure out what is going to make sense, you know, in my town, in my community, in this region, to really fully address this, and where can I have an impact? So I guess, you know, as we go forward, I would challenge you to continue to think about that. And then I'm going to check in a little later on that. But I think absolutely, you know, the mental health first aid, that's a wonderful, wonderful program. They've been around for several years. They've actually started a specific kind of subset of that that's specifically for farmers due to in rural areas, because again, these rates are so high. We're starting to see this disproportionate amount of high rates of suicide, anxiety, depression, those things. And so, you know, the need to address that has become, you know, pretty pressing for sure. So thank you everyone who contributed to that. I really appreciate that.
I think we also need to recognize that we're in a pandemic that is contributing to a lot of this. I mean, there's been a lot of issues, of course, issues that we normally have to deal with, prices and weather and all kinds of on both extremes. And we've had both extremes, but add this pandemic to it, and where we desocialize basically. We don't go to social events. We don't, and I think that really, is going to continue to have a serious effect on people. And I'm not sure how we work our way out of that.
Yeah, no, Jerry, I think I really, really am glad you brought that up, because I do think, you know, if we were having this talk 2 years ago, we were still facing these issues, but you're right. Right now, with the pandemic on top of that, stress levels are at an all-time high. You know, we were already riding kind of high. You know, I often talk about stress being kind of like a bathtub. We can only put so much in it, and then it overflows, sometimes literally and figuratively. We overflow. And so when you add all of that, the other thing I heard you say in there, Jerry, that I think is really important to emphasize is connection. For we're human animals, right? We are pack animals, and so we need connection. And I think that's the one thing that I hear so consistently, regardless of the group I'm talking to, that they're missing right now is connection, being able to connect with folks. You know, like you mentioned, there's reasons we can't get out as much. Maybe, you know, I know right now I have a 17-year-old in the house, and he's lamenting he's not getting to spend time with his friends and, you know, do all the things, and everybody can't come to the, you know, the football game or the basketball game. All those things are reducing our connection, which for a lot of people, that's again increasing that stress overall. And so absolutely, that's a great point. So is it Louis or Luis? I'm so sorry. I don't want to be mispronouncing it.
It's Louise.
Louise. Okay, so yeah, Louise. I think maybe we've met maybe at some point in time. You look pretty familiar to me, but
so. We have.
Yeah, so it looks like putting some great resources in there. Another point about, you know, having some resources available through teletherapy, very helpful. And definitely, I think that's an outlet, something that COVID has actually brought about.
I just got it up. I did just get an update today from our board chairman, our executive director. And, you know, telemedicine has really been quite helpful for those who don't really want to drive up to an office in little towns, or don't want to have a pickup there, or a recognizable vehicle. So, I mean, it's probably always been available, but really has become quite more visibly available now. And that's been a really good thing and resource. I will say to you that it's these centers have been hard hit. And the therapists themselves have been, because of COVID, in offices, have had to do it from home. So if you know any therapists, do say thank you to them or be kind, because it's been tough on them, and they have been besieged. But also, they also need state support. I mean, state support a few years ago was drastically reduced, and it wasn't kind. And
Yeah.
they've come back, but not, it never has been fully back. Now, the centers also go into schools, and that has been a new resource. So some families like that, some people don't. So it depends on what funding they get. But just be aware of your community mental health centers. If you can help them out in any way, or be on their board, or be appointed from your county, I would certainly volunteer that if you can. It's a great service.
Yes, and thank you for doing that. Appreciate that. Right here in the community I live, so that's awesome. I'm also seeing, again, just some good, and just to point out to the about being involved, being able to help support these things when in legislative processes, for sure. Always room for some advocacy there. I'm also seeing Linda had put some in the chat there too about insurance. We did have some changes there with parity and some things. And so, yes, a lot of times with insurance, mental health and substance use disorder treatment is covered. It's one of the 10 essential health benefits. And sometimes people don't realize that. There can also be some other barriers there, and we'll talk about that a little later. But yes, that's a great option. It looks like you also had put in some resources there in the McPherson area. That's great. And then Leslie, again, making the point that maybe a reason that we're not easily recognizing or easily talking about this is pride and not wanting to be seen as a weak link. Is an issue has been occurring for generations. It may take an outside source to get the individual encouragement to seek help. So yes, I think, again, just getting into the reasons why the stigma is there. I want to commend all of you actually showing up here tonight, taking time out of your valuable time. You're busy. You took an evening. Just us here talking about this is doing something towards that stigma. The more that we have these open conversations, the more that we can talk about it, bring this up, and the more likely someone is going to come forward and say, hey, yeah, this is something I need help with. So I really appreciate all the chat and folks that have contributed so far. I do want to just share a few things here, and then, like I said, we're actually going to be breaking you into some smaller groups to be able to have a deeper conversation about this. But I just want to share a few more things, and then we're going to break you into those groups. But I'm going to take you back here for a moment here and just share some more information. This was mentioned in that film, but we saw that over the past few years, we're really seeing significant economic stressors. That was just mentioned. Again, I think Jerry brought that up. We see falling commodity prices. There's been natural disasters, increasing levels of farm debt. And again, I love the point that was made earlier about COVID. All of this that's happened over the past year is just on top of all of those other things that are already there. So this has led to higher rates of stress. And then that in turn leads to, or can lead to, either making mental illness symptoms worse or the development of those, and then suicide in farm and ranch families. Suicide in Kansas, unfortunately, was the highest it's been in the last 20 years and is higher than the national rate. The rates of suicide in Kansas have increased by 70% between 1999 and 2018. And the highest suicide rates are found in counties with population densities low enough to be classified as frontiers. So across Kansas, you can look and see those that are rural, frontier, urban. And so we're seeing just those highest rates in those that, again, we have the furthest distance in between, accessing care, other barriers there. So higher suicide rates and low population density present a unique problem of delivering health care. And 99 of our Kansas counties are designated mental health professional shortage areas. So this is a real problem, you know, and it was mentioned about thanking, you know, if you know a therapist, thank them. You know, I would say any mental health professional right now, we're in a crisis, and we have been for a number of years. It's hitting rural America the hardest. You know, getting individuals that are licensed, you know, are able to provide these services out in these areas is a challenge. And so, again, as been mentioned with COVID-19, we see stress during this time can also increase use of alcohol, tobacco, and other drugs. You know, something I think that humans all have in common is we don't like to be in pain. That's a general statement, but I think it's very true that we just don't like being in pain. And when we're in pain, we'll do a lot to ease that pain, whether that means taking a Tylenol, or maybe, you know, having that drink or 2 or 5, or maybe taking in a substance, a different substance to kind of numb that pain for a while. And so the scope of the opioid crisis, you probably heard some of this, but we're starting to see this really hit our rural communities. You know, some of the stats here, 74% of families and farm workers say they've been directly impacted by this epidemic. 3 in 4 farmers say it's easy to access large amounts of opioids without a prescription, but only 1 in 3 rural adults say it would be easy to access addiction treatment. So again, we see this disparity of the access, the amount of, you know, availability of some of these opioids, but then getting treatment for it is a little harder. I know, again, even just in our rural areas, you know, I live pretty close to Garden City, Kansas, and they're seeing a huge increase in fentanyl. That's a new substance that's very lethal if taken, you know, more than the doses. And that's something that's hitting definitely in our urban areas. It kind of hit Wichita, but we're seeing it out further west as well. So something to be aware of. So just wanted to take a quick poll, and this is completely anonymous. We have no idea who's saying yes or no, but just wanted to kind of get a feel from folks. You know, if we were to, I'm going to stop sharing this, but I'm going to ask you these 2 questions. How many of you could use someone to talk to about all the stress in your life? And that could be at any point in your life. It doesn't mean right now, but at any point in your life, would it have been helpful to have someone to talk to? And then the second question there is going to be, what are maybe some of the reasons that might prevent you from doing this, or that did prevent you maybe in the past from doing that? So I'm going to go ahead and launch this poll. You'll see it there. You can, again, just answer yes or no. And then don't forget to push that submit button at the bottom. So the number 1 is just, you know, how many of you could use someone to talk to about all that stress in your life? You can answer yes or no. And that was asked I'm just now noticing that should have said, could you have used someone to talk to about all that stress in your life? Yes or no. And then what are the reasons that might have prevented you from doing this? And it could be too many things, just not enough time, you know, not really sure wanting to talk to people about my business, right? Not wanting other people to know. Or is money, you know, not having the resources, money, insurance to pay for it. We've got 73% of people have voted. If you're going to vote, we'll give you about 10 more seconds there. And again, this is not to find out who's doing what or any of that. Just want to kind of get an idea where folks are at in their life. Okay, I'm going to go ahead and stop that. So let's share those results. All right, so about 80%. So vast majority of folks could say, yeah, it would have been helpful to be able to talk to someone. You know, I think one of the benefits of talking with a mental health professional or behavioral health professional is that they're not emotionally invested in the decisions we're making. They're, you know, have a little different perspective. They're not emotionally involved in our lives. And sometimes that's easier to have a conversation. You know, what are the reasons? Again, here hitting on not sure want others to know I'm struggling. So again, maybe some of that just, you know, whether it's stigma or just not sure about allowing other people in, about 70%. So that's definitely an important factor there. And then just, you know, the time, making that a priority. I think sometimes individuals will kind of downplay that, or, you know, if we have an issue with our stomach, or, you know, we got, you know, something going on in our body, we'll go seek maybe medical care. but we maybe don't prioritize our mental health as much. And again, that's in the general population. That's not anything specific here, but I think, something that we can be affected by. So just trying to look through, I think I'm not getting to all of these, but some of the chats here, Leslie had mentioned we do have methamphetamine problems too. Yes. And I think that's definitely, we're seeing a resurgence of that actually, as well as, again, we've seen kind of a decrease in a little bit of a plateauing with the opioids and an increase in methamphetamines. Let's see, Chris had asked, go ahead.
Yeah, Christina, somebody Trumbull asked, how does the suicide rate or other metrics compare to the 70s and the 80s? I think that was a nice stress time in the farming.
Chris, that's a great question. I'm going to make a note of that. I don't know right off the top of my head, but that's a great question. I don't know with other things that were happening at those times, and again, the reporting, sometimes it's hard. Folks maybe weren't reporting all of those things, but I think that's a great question. I could definitely look into it. If I can find anything on that, I'll send it to Jill and they can try and get that information to you. But unfortunately, I don't know that right off in this brain. It's not in there.
Time of extremely high interest rates. I mean, we were paying 18, 20% interest rates. Banks were falling or failing rapidly, which put a lot of stress. And so there was a significant amount of stress especially in the early 80s. And I agree with whoever asked that question, Chris Trumbull, I guess. Oh, hi, Chris. And I think that would be interesting.
Yeah. And I know there's some other comments. There was also related that sometimes those, we may have been identified as accidents, not necessarily suicide. And that, again, there might be some differences in reporting, but it would still be interesting. I'll definitely look and see if I can find anything and share that.
Well, I was one of those, this is Jerry, that went through the 80s and paid that interest 18 and 20% and didn't think it was going to even be possible to possibly survive, and barely did. It was very, very stressful. Much of that was from the financial side.
Yeah.
And which is a little bit different, but it's very, very real and very, very serious.
Absolutely. And having gone through that, Jerry, I appreciate you mentioning that as well. Just, again, the impact that has. Anytime we increase stress, we're going to increase symptoms. It's across the board, whether we're talking about, medical, psychological, emotional. And so if we have any kind of predisposition to depression, anxiety, those kinds of things, then you add in there. I noticed earlier somebody had mentioned, PTSD. That's definitely, something that, again, the trauma that folks are facing, any of those things can bring those symptoms, up to a higher level. And so just recognizing it can be a combination. Oftentimes it's a combination of things that can really, become very dire in someone's life. There's also, let's see, some other comments there just about, having to travel for services. And I think, again, that's a huge barrier. When I was doing community mental health, working at the community mental health center, part of what I would do is go out to different communities to have clinics to try and help, bridge that gap there. But I was there, maybe once every 2 weeks. I was one person, again, we start getting into just the needs are far outweighing the workforce that we have to kind of address these are big issues. They're complex issues. Unfortunately, it's going to take probably a lot of work in a lot of different areas to truly have an impact. So yes, so thank you for all of that. I'm going to take us back just here to cover a few more things before we get you in your group so that you can talk a little bit.